it around. Okay. Does it feel good on your gums? Your tooth? Good job, honey. Good job. Yeah. Good job, Bass. That's fine too. Get the corner in there, huh? Good job. Yeah, I'll definitely try to dip that in.
This is mine. It's mine.
Yeah. Yeah. Hi. So I just started her feeding. So that's going in the bag, and then we always do like sensory play or something in her high chair. We just get her hands a little messy. Just put her fingers in it. She's learning. Yeah. And then a little bit on her tongue. I just always try to capture that exact moment when she sticks her tongue out, because she doesn't like food yet. She doesn't like food. I don't know why. It's so good. She passed her swallow study, so she can have food. Everything works good, like on the inside, internally. She can swallow. She protects her airways. There you go. I like it when she puts her fingers in her mouth. That's so good. We just need to find different tastes and textures that she likes. And her mouth has always been so tiny. So this is a preemie pacifier. We've always had problems like finding something that fits in her mouth because she's so little. And then after we do the sensory play, then I always give her a bath. Good job. Oh. Can mommy do it? Can mommy do it? Hi. Oh. Alright, it's almost bath time. We're going to do her bolus feed right now. This is 20 mLs, so she can tolerate 20 right now, and then 25 middle of the day, and then I bump it up to 30 in the evenings. So we're just going to hook her up and give it to her nice and slow. I always offer it to her first, and then do her pump feedings right after. Just little by little, she'll be able to tolerate more and more of this. Hi. You're a good girl. You're so big. Hi. Alright, almost there. There we go. Good job, honey. Good job. Alright, and then I have her pump all primed up and ready to go, so I'll go ahead and attach that next. And our goal one day is to be able to just do all of her feed by bolus feeding instead of the pump because it just runs so slow all day long. So this is a lot faster, but if I give it to her food too fast to her, then she just throws it back up at me. So that's why we have to do it this way. Hey guys, I just wanted to jump on here real quick and tell you I'm making or putting together a little video on Baisy because she's doing so well. It's been 2 weeks after her surgery and I just wanted to kind of update you guys. She is kicking her feet extra. She's sitting up all by herself, not just for like a few seconds or a few minutes, but she can sit there for 20 minutes without me having to hold her up. Or I'm always around her, of course, because I don't want her to fall, and I put pillows around her just in case. But she's doing so well, and it's very exciting. And like, she wasn't able to sit on any hard surfaces before her surgery, and so she would just be in pain all the time. And I would just always put her on soft beds or, you know, padding of some kind. And even in the bathtub, like, she never wanted to sit down. And so now she loves sitting up, and she loves watching what her brothers and sisters are doing. And it's just so exciting. And she's gaining weight faster. She is sitting up straight because she used to always be so hunched over and like one-sided and just leaning constantly. And now she doesn't have that problem at all. And I'm just, yeah, excited for the next couple months to see how she progresses and just to see how she grows. And in the last 2 months, she's grown 2 whole inches. 2 whole inches. So I just can't believe it. She went from 24.5 inches to 26.5 inches now after surgery. So I think she is just able to stretch out, which everything was just so tight for her before surgery. So she still eats from she's a tubey baby, so G-tube, pump fed, and she still spits up and stuff. So now we just need to work on her, like, bringing stuff, reaching and grasping the toys or whatever we're giving to her, and then her taking those toys and, like, I got her a bunch of new teething toys, and so she is getting a tooth on the lower in the back. So I think it's a molar, which is crazy because she's only gotten 2 front teeth on the bottom so far, and she doesn't have any on the top. And normally they're supposed to come in like in pairs, so 2 on the bottom first and then 2 on the top and in the front, but she hasn't gotten her front teeth yet. So but teething might help to like have her put toys in her mouth, and hopefully she starts being interested in that. And then yeah, the goal is to be able to feed her little by little in her mouth. So hopefully, you know, she starts taking interest in all of that. We'll see, fingers crossed, and I'll just keep working with her every day. And she's rolling now and sitting up now, so the next step is to hopefully she starts putting weight on her legs as well. I know her right side has always been longer and stronger also, and so it seems like she is starting to put weight on that right leg, but not her left one yet. So the physical therapist that we work with said that if she gets to be 2 years old, like by her 2nd birthday, we do need to start talking about wheelchairs and all that stuff if she's still not putting weight on her legs. So we'll see, and just keep working with her. Good job, Baisy. Good job, honey. Put it in this hand. Good job. Nope, that. Good job, Baze. Good job. We found something long enough to where she can share, like between, and pass it between both of her hands. Good job. Good job, Baisy. Good job. Because since this arm is so much shorter for her, it's more difficult for her to bring it to center and to, like, she doesn't reach across her body with it. So a straw is perfect because it's a lot bigger and longer, and she really likes it. Good job. It's so big. Zoo, 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 zoo. Are you a Jedi? Good job, honey. And she's sitting in this hard wooden chair all by herself. I don't have to hold her up or anything. She doesn't fall over anymore. She does so good. She's so strong. Come on, Baze. You're a big girl. We'll give it to this hand. Good job. There you go. What are you thinking about? Huh? Pretty dress. She loves dresses lately. They're just nice and comfy and flowy. Want me to hold you? Come here. Look what I got. Hello, Baze. Oh, my baby. My baby. There she is. There she is. And blueberries. We just started. I was putting Pediasure in this, but now we're starting the Syringe Bolus feedings with the baby food. So we're able to do 30 milliliters now of this, and then we just do like 70 to 80 in the pump over an hour, and she's done feeding, and then she has 2 hours off between hooking up her next feed. So that's awesome. Then every time I give her food, this is pretty thick, and so I always have to just like wash it with 10 milliliters or 5 to 10 milliliters just to flush it through the tube the rest of the way, so it doesn't back up her tube and get stuck in there. Alright, I got her hooked up. I always make sure she's like sitting up too, so when I give it to her, and I just push it in really slow.